Today's topic, stress.
Stress is the process in which we perceive and respond to certain events, called stressors, that we decide are threatening or challenging.
Responses to stress.
Via the hypothalamus and pituitary gland in the cerebral cortex, the outer part of the adrenal glands secrete glucocorticoid stress hormones. The two stress hormone systems work at different speeds. Robert Sapolsky used this example. In a fight-or-flight scenario, epinephrine is the one handing out guns. Glucocorticoids are the ones drawing up blueprints for new aircraft carriers needed for the war effort.
Hans Sale saw that after having a physical or an emotional trauma, you will have 3 phases in GAS. In phase 1, you are giving a shock, so your heart beats faster and all your blood is diverted to your skeletal muscles. This enables you to be able to fight. Phase 2 is resistance. Your body temperature, blood pressure, and your breathing will remain high, and you will have a sudden outpouring of hormones. Phase 3 is exhaustion, which succumbs your body to be more prone to illness. Also, it could, in extreme cases, cause you to collapse and die. In cases of men versus women, women have been shown to be able to deal with stress better than men. When men become stressed, they typically socially withdraw and turn to alcohol or aggression. However, women have shown to tend and befriend, meaning that they become more nurturing and look to other women to rely on. This seems to be due to oxytocin, which in nature is a relief stress hormone, and it's also found in women during breastfeeding.
So let's talk about health and stress. In addition to hypertension and a family history of the disease, many behavioral and physiological factors, such as smoking, obesity, a high-fat diet, physical inactivity, and an elevated cholesterol level, increase the risk of heart disease. The physiological factors of stress and personality also play a big role. Those who seem the most reactive, competitive, hard-driving, impatient, time-conscious, super-motivated, verbally aggressive, and easily angered are called type A. Those on the opposite end are called type B. Stress also affects our health and physiological illnesses such as hypertension and some headaches. Stress also affects our resistance to disease, and this understanding has led us to developing in the field of PNI. PNI studies how psychological, neural, and endocrine processes affect our immune system, and how all these factors influence our health and wellness. If there is a connection between stress and our immune system, could that increase the exacerbation of AIDS? Research has found that stress and negative emotions do correlate with A, the progression of AIDS, and B, the speed of decline in those infected. Even though the comparison of counseling and stress-relieving therapies would be small in effect compared to medicines, it would still be beneficial. Stress and negative emotions have also been linked to the progression of cancer. Research shows that mice filled with carcinogens, which are cancer-producing substances, and put in stress-induced environments seem to grow their tumor larger than those without the stress. Studies that also show that workplaces that have a 5.5% increase in stress have a greater relation to cancer. However, these studies are not supported, as cancer patients might believe that they could have done something or more with their life in order to prevent it. And that's our lesson on stress today.